Hi, everyone. This is Michael King with Schneider LASIK Centers, and I'm joined here by our surgeon, Dr. Mark Schneider. And we're really excited because we're going to have an opportunity to go through and answer the top 10 questions patients have about LASIK. And so hopefully, after you've had an opportunity to kind of watch through this video, this is going to help you out in your visual journey to kind of make that decision if you want to find out if you're a candidate. But really, what we'd love to do is just to kind of use this information to help you out in your process. And with no further ado, Dr. Schneider, do you want to say hello?
Hi, everybody. I'm Dr. Mark Schneider here coming to you from Schneider LASIK Center. I'm glad you're joining us for this quick infomercial, if you will.
Nice. So the first thing is, and we do get a lot of questions about laser vision correction. And one of the ones I want to just tackle right away has to do with your recovery time. And so patients always like to ask us, what is the recovery time of LASIK? Like, what can you expect right after the procedure? And then really, how much time are we going to need to take off of work? Dr. Schneider, what are your thoughts?
Well, really, the recovery time is really minimal. Basically, we do the procedure. We ask that you go home and take a nap for a couple hours. And then most people return to work the next day. I mean, there are some restrictions. Some people in the healthcare industry, maybe we want them to take a day or two off.
Sure.
But most people are able to go back to work the next day. No problem.
Absolutely. How would you describe the first few hours after laser vision correction? What are some of the sensations that someone can be feeling?
So at first, the numbing drops will last for about a half an hour after the procedure is done. And once they start wearing off, you'll feel a little bit of a burning and watering. It feels kind of like a little grain of sand is in the eye. And that lasts for about 2 hours. Typically, though, we'll give you plenty of sedation so you can go home and take a nice restful nap and sleep through that part.
Excellent. The next question I wanted to ask is to talk about the safety of laser vision correction. So obviously, you can imagine from a patient's perspective, it's like this is your eyes, there's worry about something happening. And so let's talk about the safety of this procedure. How safe is LASIK?
So that's probably the most common question that we have. And as you said, people are really fearful. They think, am I going to go blind from this? And that has never happened. LASIK is probably the safest procedure in all of medicine. The last 10 to 15 years have been phenomenal as far as our advancements and safety. We stopped using blades and we use only lasers, which make it exceptionally safe. In fact, the lasers are so safe, we have to calibrate them between each patient. And if it's not working absolutely perfectly, then the laser won't let us fire. Some of the other safety features that have been built in is there's a tracking device on the lasers. So if your eye moves a little bit, the laser will track you, so you don't have to worry about that. But really, it is probably the safest procedure in all of medicine.
Excellent. And of course, if there's any questions that you have outside of just being able to get what you got here on this video, don't hesitate to text us or email us or call us with any questions. We'd be happy to be able to answer those for you. Number 3 is about the differences between LASIK and PRK. So maybe we could just give a quick little introduction of the differences between those two procedures and why somebody might have LASIK versus PRK.
So the basic difference between LASIK and PRK is that with LASIK, we're doing the corrective procedure underneath the flap of the cornea. And with PRK, we're working on the surface of the cornea. And the main difference is in the healing process. So with the PRK, it takes a couple extra days to heal because that surface has to grow back in. Versus the LASIK, with that flap acting as a human Band-Aid, the eye heals really quick. And usually within 2 hours, the flap is completely healed and sealed. Now, there's a difference, and we do use one versus the other depending on the health of someone's eyes. So if someone comes in and their cornea is too thin and they don't have enough room to make a LASIK flap, then we'll work on the surface of the eye. Or if, say, someone has a scar from an infection from a contact lens that we want to remove at the same time that we're correcting the vision, we'll do the PRK also at that time instead of the LASIK. You get kind of a 2-for-1 benefit by doing it that way.
Excellent. And really for us, what we want to be able to do is to bring you on in for your initial free consultation to help kind of just to find out exactly what's going on with your vision and which is the most appropriate option for you. We'll go through that for you at your initial consult. Question 4 is another one of the more common questions that we get, which is how much does LASIK cost? And there's For some people, there's a bit of a misconception on exactly how much does this procedure cost. At our practice, we believe in transparent pricing. And right now, with current specials and discounts, pricing at our clinic is $2,200 per eye for laser vision correction. We do have zero money down, 0% interest financing for up to 24 months. You'll find that we're right on the industry average for pricing for laser vision correction, and we give an outstanding level of care, and also the technology that we use is some of the most advanced technology in the world. So Dr. Schneider, do you want to comment a little bit about the technology that we're using and the actual treatment itself?
You know, the technology we use, as you said, is the most advanced technology on the market. I mean, we use the intralace laser to make the flat portion in LASIK, and then we use the VisX S4 laser to do the reshaping with the custom view on the cornea. So you're getting the best technology available.
And some of the other questions about cost that people ask is, what about if you know, your company pays for, you have an insurance discount or flex spending? Absolutely, you can use flex spending for this treatment. Whether or not your company actually covers some portion or you get any savings as part of, you know, whether you might be in a union or whatnot, we always recommend that you connect with your HR manager or your benefits coordinator, and they'll be able to give you all the answers that you need with respect to any sort of additional discounts. But again, this is definitely a procedure you want to, and you know, you're investing in your eyes, and you want to have some of the best technology available to do that. Question number 5 is relates to, is LASIK permanent, or do I need to have it done multiple times? So maybe we could talk a little bit about that. What are your thoughts, Dr. Schneider?
Well, that's a very common question. Also, there's a lot of misconceptions out there about the permanency of the LASIK procedure. We do consider it a permanent correction of the vision. But does that mean that the eyes can't change? Absolutely, it does not mean that. The eyes can change over time. It is rare. In our hands, less than 1% of people ever need to have the eyes enhanced or touched up. But that doesn't preclude the eyes from the normal aging process. You know, what can happen as we get older? We have a lens on the inside of our eye that loses its ability to change shape, and people can start to have reading difficulties in their mid-40s. Now, we have some things to address that as well now. But yes, LASIK is considered a permanent correction of the vision.
Absolutely.
To answer the question, I'm sorry, about multiple times. So if someone has to have it done again, there's several factors that play into that. If as long as they have plenty of corneal tissue and it's safe to do so, most of the time, if we have to do a procedure again, there's plenty of room to do that. And we'll talk about that more at the time of a consultation. That's part of the consultation because we truly believe in a lifetime of clear vision, and we want to plan for the rest of your life, not just for the next 10 years.
Absolutely. And here's another common question that we get, which is, you know, you're having the procedure done, and you know, obviously we want to find out, are there any side effects? Is there anything that a patient should be concerned about after LASIK?
Well, the first thing is determine if you're really a great candidate, because that's going to determine if there's any side effects. You know, so one of the things in our region where we work and live is it's extremely dry here. And we find a lot of our patients have pre-existing dry eyes. And the laser does typically make the eyes a little more dry for the first couple of weeks, but 100% of people go back to their baseline level. Again, I don't want to harp on the consult, but it's important to determine if there's pre-existing dryness so we can address that at the time of the procedure as well. Some other temporary side effects that people will notice is that occasionally there'll be some halos and glare around lights at nighttime for the first week or two. It can fluctuate a little bit as it's healing. Those are all normal things that tend to go away as time goes by.
Excellent. You know, question 7, and we have talked about this a little bit earlier on, just in the candidacy and how your eyes change, but just to kind of revisit it again on question number 7 here is, I'm over the age of 40. How will having LASIK done affect my reading vision?
So we have a variety of options for the over 40 crowd, and LASIK happens to be one of those options. And what we'll do is we'll determine your lifestyle and how you use your eyes and determine what's the best way to fix your eyes. We can do what's called LASIK blended vision. We can do what's called an RLE, which stands for refractive lens exchange. So we have a lot of options to correct both distance and near vision. So we really here don't believe in one size fits all. We have a variety. In fact, we do 7 different refractive procedures here at Schneider LASIK. LASIK happens to be the most common one, but we have a variety of things in our toolbox to fix your vision.
Absolutely. So what it comes down to is that it's not a one size fits all for everybody. What we want to do is have the opportunity to connect with you, find out exactly how you're using your vision, especially, you know, over the age of 40 with those adjustments and changes in your eyes. We want to make sure we give you the best visual outcome that suits your lifestyle. So, you know, again, back to your point, when we have that opportunity to connect with you and find out where your vision is, then the best option for you becomes much easier for us to prescribe. Question number 8, it's a very common one that we get, and it's just real simple. Can LASIK treat astigmatism?
The easy answer is absolutely. There's a common misconception out there that LASIK doesn't treat astigmatism, but we've been treating astigmatism for more than 20 years.
Yeah.
Absolutely.
Yeah, it's interesting. Most people don't understand what an astigmatism is. It's kind of like when your eyes shape more like a football than a basketball. And so it's causing light rays that were supposed to land on one point to land on multiple points, which can cause a little bit of that blurriness in your vision. But absolutely, astigmatism is treatable with laser vision correction. Question 9 is, does LASIK hurt? So during the actual treatment, you know, patients would wonder, like, am I going to feel it? Is there going to be pain involved? So what's your answer to that question?
No one has ever really said that LASIK hurts, but there is a little bit of sensation. You are awake during the procedure. We do give you some sedation to kind of, you know, mellow you out and help with the anxiety. But during the first part where we're creating the flap, you'll feel a little bit of pressure.
Yeah.
But no one has really described it as pain. It's just a little bit of pressure.
Excellent. And, you know, question number 10, and we've alluded to this earlier on, which is really, how do you know if you're a candidate? And the best answer is that, you know, you want to come on in. We'd love to invite you in for a complimentary evaluation to see and find out exactly what's going on with your vision, to see if you're a candidate. And so, you know, for us, we take a very organic, relaxed approach at Schneider LASIK, in the sense that we want you to feel supported, and we want to be able to give you all the information that you need to make sure that that you are ready for, you know, for this journey, if you will, in laser vision correction. And so I'd love to kind of hear your thoughts, Dr. Schneider, is like, if you've got somebody who's interested in laser vision correction, what would you say to them at this point if they're kind of wondering, you know, whether or not they're a candidate or not?
Well, I mean, the number one thing is we need to take a look at your eyes, and we need to get to know who you are as a person, because again, we don't try to put everybody into the same little box. We try to customize the procedure so it fits you and your lifestyle. And so part of the coming in for the consult is we need to get to know you. We need to get to know what you're about, what you like to do, what your hobbies are, again, so we can fine tune or customize the treatment for you. So again, really, it's important to come in and just get to know us so we can get to know you, so we can help you achieve your goals.
Absolutely. And so if at this point you're sitting and you're saying, you know what, I'd love to, you've answered my questions, or you've been able to provide me with information, I feel comfortable that I'd like to come on into your practice for that consult, you can either be able to schedule it directly on our website, or if you want to, at the end of this video, you can kind of text us. There'll be a word that you can be able to text that lets us know that you want to be able to schedule. So got a variety of different options. Obviously, we also use text messaging as well. Or if you want, just pick up the phone and call us. So there's a lot of different ways that you can be able to schedule that initial consult. But our hope again here today is that that you have found this video to be of value. Just answer those questions that you have about LASIK, and we'd love to have that opportunity to see you when you come into our practice. So Dr. Schneider, I'll give you the last word that you'd like to, just before we end the video, of anybody who's kind of thinking about LASIK, as any parting words you'd like to have to give to them.
I think I'm excited for you all. I'm glad you're taking this first step to learn a little bit about the procedure and how life-changing it can be. And I look forward to meeting you.
Awesome. Thank you very much, everybody.
Thank you.